Today, we will be going over all the terms in AP Psychology, Unit 5. I decided to make Unit 5 videos first since the majority of AP Psych teachers are wrapping up their final unit at this time, and the Unit 5 test might be coming up next. Let's get started on health psychology and disorders. Health psychology is the study of how mental, emotional, and social factors affect your health. Psychoneuroimmunology is study of how the mind, brain, and the immune system work together. Hypertension is when you experience high blood pressure, which is caused by stress. Immune suppression is when the immune system is weakened by stress. Eustress is positive stress that motivates you, such as feeling excited before a big game. Distress is negative stress that makes you feel overwhelmed. Adverse childhood experiences are traumatic events in childhood that can affect your health later in life. General adaptation syndrome is the body's response to stress in 3 stages. Alarm is the first stage where the body gets ready to deal with stress and the heart rate goes up. Resistance is the second stage where the body tries to cope with stress, staying alert. Exhaustion is the third stage where the body's energy is all used up. Fight, flight, freeze response is the body's quick reaction to danger. Coronary heart disease is a disease of the heart's blood vessels and can be worsened by stress. Tend and befriend theory is the stress response where people protect others and seek help. Catharsis is releasing strong emotions to feel better. Coping is just dealing with stress. Problem-focused coping is solving the problem that is causing the stress. For example, when you create a study plan to deal with schoolwork. Emotion-focused coping is managing your emotions instead of the problem. For example, watching a movie after an argument with your parents in order to make yourself feel better. Positive psychology is the study of what makes life worth living and how to be happy. Resilience is the ability to bounce back after hard times. Subjective well-being is how happy you feel about your own life. Adaptation level phenomenon is getting used to new things then wanting more. For example, when you're feeling excited over a new phone but wanting a better one later. Relative deprivation is feeling worse because you compared yourself to others. Signature strengths is your best qualities, such as kindness and honesty. Virtues are positive traits like kindness. Character strengths are good parts of our personality. Temperance is self-control. Transcendence is feeling connected to something bigger than yourself, such as when you feel peaceful when looking at the stars. Broaden and build theory is positive emotions that help us grow and build skills. Mindfulness meditation is paying attention to the present moment with no distractions. Psychological disorder are mental condition that affects thinking, feeling, or behavior in a bad way. Dysfunction is when something doesn't work normally in life. Stigma are negative beliefs about people with mental illnesses. American Psychiatric Association are professionals who study and treat mental health issues. Diagnostic Manual of Mental Disorders is a book used by doctors to diagnose mental disorders. International Classification of Diseases is a book by the World Health Organization created that classifies diseases, especially mental ones. Eclectic approach is using different types of therapy together, such as CBT and medication. Maladaptive behaviors are actions that make life harder instead of helping, such as when you avoid school because of anxiety. Maladaptive thoughts are harmful ways of thinking. Maladaptive relationships are unhealthy or harmful influences. Medical model is when you view mental illnesses like a physical disease with causes and treatment. Diathesis is a vulnerability for mental illness. Diathesis stress model is mental illnesses happen when someone has a risk and faces stress. For example, a person with a family history of depression gets depressed after breaking up with someone. Neurodevelopmental disorders are disorders that start in childhood that affect brain development. Autism spectrum disorder is a disorder with difficulties in communication. Attention deficit hyperactivity disorder, also known as ADHD, is a disorder with trouble paying attention. Schizophrenic spectrum is when it causes illusions, hallucinations, and disorganized thinking and speech. Delusions are false beliefs that are not in reality. Delusions of persecution is when you believe that other people will harm you. Delusions of grandeur is believing you're a super important person. Hallucinations is when you see or hear things that aren't really there. Disorganized thinking and speech is talking in a confusing way. Word salad is a mix of random words that don't even make sense. Disorganized motor behavior are unusual body movements. Catatonia is a lack of movement or reaction. Stupor is a no response to the environment. Catatonic stupor is being frozen in one position and not responding. Negative symptoms is when you lose normal abilities such as emotion and speech in terms of schizophrenia. Flat effect is when you show little to no emotion. Positive symptoms are extra symptoms like hallucinations or delusions. Schizophrenia is a disorder with hallucinations, delusions, and disorganized behavior. Acute schizophrenia is sudden schizophrenia, often after stress. Chronic schizophrenia is long-term schizophrenia that gets worse over time. Dopamine hypothesis is idea that too much dopamine causes schizophrenia symptoms. Depressive disorders is when someone is on low mood, loss of interest, and feels fatigue. Major depressive disorder is strong sadness and loss of interest for 2 weeks or more. Persistent depressive disorder is long-term low mood lasting for years. Bipolar disorders are mental health conditions with extreme mood swings. Mania is a state of high energy, little sleep, and risky behavior. Depression is feeling very sad, tired, and hopeless. Bipolar 1 disorder is when you have severe manic episodes, often with depression. Bipolar 2 disorder is when you have more of a mild state of mania, also known as hypomania, and depression. Anxiety disorders is where a person feels fear or worry that affects daily life. Specific phobia is strong fear of one thing, such as fear of spiders. Acrophobia is the fear of heights. Arachnophobia is a fear of spiders. Agoraphobia is the fear of public spaces. Panic disorder is having repeated panic attacks. Panic attacks are sudden, intense fear with physical symptoms. Culture-bound anxiety disorder is an anxiety disorder specific to certain cultures. Social anxiety disorder is intense fear of being judged in public. Hygiene confusion is a fear of offending others with appearance of smell. Generalized anxiety disorder is the constant worry about many things for months. Obsessive compulsive disorder, also known as OCD, is a disorder with obsessions and compulsion. For example, if you're constantly worrying your hands are dirty, such as obsession, you tend to wash them over and over to treat that obsession, which is known as compulsion. Dissociative disorders are disorders where a person feels disconnected from their thoughts, identity due to trauma. Disassociations is a break from reality, memory, or identity. Dissociative identity disorder is having two or more separate identities. Dissociative amnesia is forgetting personal information after trauma. Trauma and stressor-related disorders are mental health problems that come after a scary event. Post-traumatic stress disorder, also known as PTSD, is ongoing stress after a traumatic event. Hypervigilance is being alert. Emotional detachment is feeling numb or disconnected from others. Hostility is when you feel angry. Feeding and eating disorders are harmful eating habits. Anorexia nervosa is starving yourself and being afraid to gain weight. Bulimia nervosa is eating a lot and then forcing yourself to vomit. Personality disorders are long-lasting patterns of behavior, thinking, and feelings that are bad. Cluster A is odd behaviors and thinking. For example, paranoid, schizoid, and schizotypal. Cluster B contains of dramatic and emotional, such as antisocial, borderline, histrionic, and narcissistic. Cluster C contains of anxious and fearful, such as avoidant, dependent, and obsessive compulsive. That is the end of Unit 5 Part 1, and Unit 5 Part 2 will come out soon, and subscribe if you want to learn all the terms in AP Psychology.